Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then the drug spironolactone. Spironolactone is a potassium sparing diuretic. And this the drug of choice for spironolactone. It is used in the refractory ascites. It is a drug of choice for refractory ascites. The most common side effect of spironolactone is actually hyperkalemia. And this spironolactone is a prodrug. So spironolactone is a prodrug, so it gets converted into eplerenone, not eplerenone, sorry, canrenone. This spironolactone is a prodrug, so it undergoes metabolized and it forms canrenone, which this canrenone can be is eliminated in the urine. Therefore, this spironolactone is contraindicated in renal failure because it is eliminated in the urine. These drugs act on the these drugs mainly this spironolactone is an aldose these are potassium sparing diuretics. True, they are actually aldosterone receptor blocker. Because it is an aldosterone receptor blocker, so spironolactone is an aldosterone receptor blocker. So it blocks the aldosterone, and because it blocks the aldosterone mainly causes reabsorption of sodium and water and causes excretion of potassium. So as a result, spironolactone will cause excretion of sodium and water and causes reabsorption of potassium. Uses of spironolactone. Spironolactone is used in Conn's syndrome. In Conn's syndrome, it is actually a primary hyperaldosteronism. So, spironolactone is used in Conn's syndrome. Conn's syndrome occurs due to increased aldosterone levels. So, by blocking the aldosterone receptor, obviously the action of aldosterone is blocked. So, spironolactone is the drug of choice in Conn's syndrome. It can also be used in secondary hyperaldosteronism, where there is increased aldosterone level. It is also used in hirsutism because even in hirsutism there is increased chances of sodium and water retention, especially due to the um, hirsutism which is caused due to adrenal hyperplasias. In them, we can use this spironolactone. Side effects of spironolactone. Spironolactone will result in hyperkalemia because spironolactone blocks aldosterone receptor, so secretion of potassium is not done. So as a result, potassium is retained in the blood, causing hyperkalemia. It is also used in sulfur allergic condition. It can cause sulfur allergy because this spironolactone is made up of sulfur containing drug, so it can cause sulfur allergy. And one important thing is gynecomastia. Gynecomastia is mainly seen in the aldosterone receptor blockers, and the most common drug causing gynecomastia is nothing but spironolactone. Then we have for gynecomastia, if the gynecomastia is painful, for painful gynecomastia, the drug of choice for painful gynecomastia is actually tamoxifen is the drug of choice for painful gynecomastia. Then one more thing is one more aldosterone receptor blocker, not aldosterone receptor blocker. It is an epithelial sodium channel blocker, which is tramterine. Tramterine is an epithelial sodium channel blocker. The important point about tramterine is it should not be given with indomethacin. It should not be given with indomethacin because when you give tramterine with indomethacin, this can result in renal failure.
thank you and thank you for watching.